Good morning. I'm Amy Smallers, Director of Healthcare Education and Professional Development at the Massachusetts Health and Hospital Association. Welcome to today's Executive Insight Series session. We are thrilled to be continuing this series, which has hosted nearly a dozen interviews with healthcare leaders on the most important topics facing our Commonwealth patients and caregivers. A few logistics before we start. We will be recording this session for those who aren't able to join us today, and all lines will be in listen-only mode. If you have questions during the webinar, please enter them into the chat feature. The questions will come directly to us, and we will do our best to get them addressed with our time together today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I would like to take a moment to thank MHA's 2024 annual sponsors, as well as our strategic partners for their support in underwriting MHA's education programs. In particular, I would like to thank today's program sponsor, Robinson & Cole. Robinson & Cole is a full-service AM 200 law firm with a robust healthcare practice, serving healthcare and life sciences clients throughout Massachusetts, as well as nationally. They are experienced lawyers trained to help clients meet their business objectives with complicated legal and regulatory frameworks. They are a valued partner in fulfilling our mission at MHA. I will now hand it over to Kate Healy, partner at Robinson & Cole, to say a few words.
Thank you, Amy, and thank you to the MHA. Nathaniel and I and everyone at Robinson Cole is pleased to be with you this morning. We always learn from these discussions, and we're particularly pleased this morning to talk to Dr. Alan Smith.
Kate, you muted.
Good morning, everyone. I don't know if you were able to hear me before. My name is Kate Healy, and I'm a partner with Robinson & Cole. Nathaniel and I and everyone at Robinson Cole would like to thank Amy and the MHA. We are very pleased this morning to be with all of you and would like to welcome Dr. Alan Smith.
Thank you, Amy, and thanks, Kate, and thanks to everyone for joining us this morning for our another Executive Insights episode. It's always great to be with you and have these conversations with leaders. We launched this series with really a simple goal in mind: to hear from the leaders who make world-class healthcare possible each and every day. This is our opportunity to pick their brains a little bit and get an up-close view to how they are shepherding their organizations through a time of rapid change, all while supporting patients, caregivers, and the communities they serve. But it's also a chance to learn about the person behind the leader, their career journey, their passions, their advice for others. With that in mind, we're excited to welcome Dr. Alan Smith today as our guest this morning. Dr. Smith has served as President and CEO of South Shore Health since November 2020, where he oversees a base of 5,400 employees, a 400-bed flagship hospital, a medical center, VNA, urgent care operations, and numerous other services that are so critical to the health of the South Shore region. Dr. Smith has been one of the system's most innovative leaders for more than 3 decades, previously serving as president of the Brigham and Women's Physicians Organization, a faculty practice plan for more than 1,800 physicians. He's a leading voice for community healthcare, strategic planning, and workforce development. We are especially grateful that he has now brought this expertise to MHA as a member of our Board of Trustees. Dr. Smith, thank you so much for joining us this morning.
Steve, thank you very much, and I really appreciate the opportunity to be here, and thank you for letting me join the board. I'm really excited about it.
Well, it's great to have you, and it's great to always hear your perspective, which is so important to our members and to our patients. But let's go back in the Wayback Machine today and start at the beginning. I know we have some pressing issues, and I don't want to not talk about the soup du jour. But what originally drew you into healthcare, and then into primary care as a physician, where it's been so difficult to attract young physicians into primary care practice?
So, it's a good question. I think it was really my mother that was influential. I'm lucky that she's still alive. She's 97 and still going strong. But I think she saw that, I was interested in science, I think pretty good in school, seemed to really enjoy people and being connected with them, and thought that would be a good idea. She encouraged me to do volunteering. I grew up in Williamstown, so at North Adams Regional Hospital, and I'm excited to hear they've reopened, but that was where I first started. And I just loved being there and loved being part of healthcare and part of a hospital environment. Primary care, I think, came later. I think when I was in residency, I was mostly thinking about it, but in residency, I started doing various rotations as you do as you get to your last year at Pennsylvania Hospital. And I remember doing cardiology, and there was we were doing a consult, and I said to the cardiologist, this guy's actually got some interesting thyroid function tests. And he said, I'm a cardiologist. I don't really care about the thyroid. And I thought, okay, I'm going to be a PCP because I want to care about everything. So that's kind of how I did it. So
it's funny you mentioned your mother's one of the few to talk to you, Dr. Smith. I know you operate with such humility. You call me Alan. My mother calls me Stephen, but yours is so proud that she calls you Dr. Smith.
She really doesn't, but when I get the letters from her, it's always Dr. Allen.
It's great. I always say my mother's the one that writes our bios, right?
Yes, that's
moving along your career journey. You moved from primary care, and then you took on a path of leadership, and have done such an incredible job in every stop along the train. How has your experience as a physician shaped your approach as a leader?
It's a good question. I've thought a lot about that, Steve, because in some ways, being a physician is helpful to being a leader, and in some ways it's not. So let me give an example, start with where it's not, which is, as a physician, you're trained to diagnose and treat. And often, and I think the higher up you go, the more you realize you're spending more time asking questions and trying to understand from others what is going on and what the diagnosis is. And maybe more importantly, you're rarely prescribing the treatment. Like I always say, if I have 2 good ideas a year, it's a good year. Most of my strength is recognizing we have a problem and looking for the team, challenging the team to come up with good ideas, and then approving the right ones, and then making sure we execute properly. So I think that's a difference. I think what's similar, and I remember when I practiced for 10 years at Salem Hospital, and when I was first going to Tufts Health Plan and leaving practice, which was the hardest decision I made professionally, I remember there was a neurosurgeon, Dr. Arena, and he came up to me and he said, Alan, just do me a favor. Don't start sounding like a suit. He said, never forget that you're a doctor. Always remember that when you talk to others. And I've always internalized that. I thought that was great advice. The other thing is, what I think primary care teaches you is you have to be in the moment. You're seeing 20, 25 patients a day. You can't be thinking about the patient before or the one coming afterwards, or what's for supper tonight, or the kids' ball game. You have to be present. So when I'm in meetings now or in one-on-ones, I am 100% focused on that person and what they're saying and listening intently. And I think primary care teaches you that.
It's funny, you mentioned the primary care practice, you're looking at the whole person. And I'm pondering for the first time whether we see some physicians that don't make the jump to leadership as effectively as you have. And I wonder if it is the difference between the surgical strike versus the whole body, and you're able to see the big picture because that's what you've been taught to do.
Well, I like to believe there are a lot of wonderful PCPs who become leaders, but we have a lot of emergency medicine physician executives
Yes.
in our core right now. But, I also see them, by the way, a little plug for them. And I was saying that to our CMO, who's a former chief of ED. They're like the catcher on the baseball field. They're the only ones who see the entire field, because they see what's coming in from the outside and they see what's going on the inside. So I think in some ways, you're probably right, Steve. That's a good point. Not to take anything away from surgeons or psychiatrists who are great leaders too, but you're right.
Incredible. But you're right. In this time of chaos, you're right. We do have a few emergency room docs that are leading our institutions. And with the challenges we face, their ability to be calm in almost every situation, I think has been helpful to us as a group.
Absolutely.
Well, let's talk a little bit about where you are now. I mean, the title of today's episode is play on South Shore's motto. Your health, our passion, one community. And your organization lives up to that commitment every day. Your community just supports, loves, and needs your institution. What was your original impression of the system? You took it over at the height of COVID, particularly as a community hospital. And how have you seen it evolve now through COVID since you've arrived?
No, it's a great question. So, I'm somewhat in a unique situation, Steve. You mentioned I was at the Brigham running the physicians organization. About a third of my job was network development for the Brigham. So that meant leading the relationships with South Shore, several other community hospitals in Massachusetts and some in Rhode Island, South Shore being kind of the flagship relationship. So I kind of had this naive view that I understood the hospital and what made it tick. as I entered this role, and I was very wrong. I had never been in the ED, on the floors, in the ICU, and the mother infant unit, what have you, the medical center, our primary care and specialty primary care. And I realized I really didn't understand what made it tick. And I was so impressed and fell in love with it immediately. I realized it's the people, their passion for providing high quality, high end healthcare, as well as being there for this community, and the way they give of themselves and connect with patients. And this was in the middle of COVID, and it was extraordinary to watch. So that really inspired me. And so there was a lot of good going on. At the same time, I recognized, like any leader, things had to change and evolve, and we've made some changes as well. But you start by understanding the history and the heritage and what makes the place great. I will say, and I've worked with lots of hospitals when I was at Tufts doing Secure Horizons and going all over the state, the commitment of this community and the hospital system itself and our board to this community is second to none. It's really amazing.
Yeah, you've always had an incredible board and good leadership, and you seem to fit right in, and they certainly adore you and your leadership style. Let's talk about outside the walls of the hospital and then get inside the walls. I mentioned the soup du jour. Well, the soup du jour is capacity. So outside the walls of the hospital, you're in this institution, you're leading it well, you're coming out of COVID, you have your challenges like everybody else. There's a flood at Norwood, a fire in Brockton, a closure of Compass Health. You go from 370 patients to 570 on some days at your height, 473, I think you said today. How do you do it? I mean, how are you load balancing? And then inside the walls, how are you keeping your team focused on the enormous responsibility they have to treat your patients in your community?
Yeah, thanks for asking that. And could I add also Quincy Hospital closing as well?
Yeah,
And the emergency room in 2020.
Yeah, pile on.
So yeah, and so you're right. And you cited the statistics. We've been running 110 to 120% occupancy for the last 4 or 5 months. So and you're right. And the final was the fire, the electrical fire Brockton, the Signature Brockton, and they're going to open, and we're staying in close touch with them. So we're optimistic about the exact timing. We'll see, but I think we're looking at a matter of months here. So yeah, how do you do it? First of all, I don't think you can go from 80% occupancy to 110 in 3 minutes. So we were always very busy, and part of that was just incredibly busy emergency room. We were the 4th busiest. We're now the 3rd busiest. We're probably, last year we were 4,000 fewer visits than MGH, and we're still growing. So how do you do it? I think you hire a great team. When I got here, there was the COO position was open. I brought in Bill Johnston from the Brigham and empowered him to work on things. The number one thing I think we did was focus on data and operations, Steve. This is a wonderful place, but we were not, like a lot of systems, we can't afford all the sophisticated data systems. We had to do the best we could, and we actually have good data now. And then how do we lower length of stay? So we actually worked with consultants. Thank God we did it. This was before Brockton closed, but we were able to lower length of stay by about 1/3 of a day. So most hospitals are going up. That's about equivalent to 20, 25 beds a day that we're not having to fill, or staff. Steve, you've come with me. You were kind enough to come down and go on interdisciplinary rounds every day. And I'm going to try to get up there today at 10. At 10 o'clock, each floor has the hospitalists, the nurses, case management, physical therapy, going over every patient and what are the barriers to discharge. And it's made a dramatic impact on that. So that's one of the things. I think in general, focusing on our team, and I'm happy to take that as a second question, but I think you have to make a multifaceted approach to be there for your team and make this a great place to work. We are not fully there yet, I won't tell you, but I think we're on the right path.
Yeah, I'm going to just dig into this for a minute, because I did really appreciate the privilege of being able to join you now, I think twice in the last year. And I had 2 unique experiences, and maybe comment on both if you could. The first, we visited with some of our elected leaders, and we talked to some of your staff, and I was just moved by a young nurse who, when she was asked, what her biggest worry was, it was being able to deliver the best care for your patients, with so many people coming through the door, and a real worry about that. And the second piece, when we went on those rounds, what really I was impacted by is, in a place that was so busy, there wasn't chaos. Your staff was calm. They were in control. They understood it. They understood every patient. I mean, something's going on with the culture there, that your workforce is focused on patient care, and then doing the right thing and managing correctly through this great, enormous chaos that's happening around them. Can you talk a little bit about your workforce, the resiliency?
Sure.
How is it happening?
Yeah, and actually, I remember that very well, and I remember the nurse, and she's since become a nurse practitioner and now recently a mom. But she did say right to Speaker Mariano and you that she's worried that there are days there were just too many patients that she could not provide safe care. And I went to her afterwards and I said, "Thank you for your honesty and your courage." That you have to do, because when you sit there and say, "How dare you say that in front of some of the most powerful people in this commonwealth," that's going to get you into, that is not a place you want to be. So you want to make sure that they feel comfortable. So I would say, it's a complicated answer. It's multifaceted, but I would say it's a number of things, Steve. First of all, I think you do have to focus on operations. When every day things are broken and you're running around, you can't find equipment, you can't order an MRI and get it done, you can't do this, you can't do that, people get frustrated. So we've lowered the length of stay. Our CT, MR, and echo turnaround times we lowered by 60%. That makes a huge difference. Having enough supplies there every day, having a rapid response team available for any patients, particularly for our young nurses that we're training, and a palliative care team. So all of those investments, we have 2 trainers on at night to make sure they're available training 24/7. So that's the first thing, is that investment. The second is quality and safety. So we hired Carol Cohane from who lives here in Norwell, who's a nurse by background. She came to us from Kaiser Permanente and previously Crico, and she has taken us on a high reliability journey. So that's about just culture. So that's about looking at risks head on, but moving away from the culture we've had in healthcare for years, which is something bad happens, somebody gets punished, somebody gets fired, somebody's career just got ruined. And you recognize that 80 to 90% of the time it's systems issues. Yes, there are occasionally people issues, but if you turn it around and make it a system issues, people want to solve problems. We do collaborative risk reviews, and people are participating to say, this is how we can make the care better, but it's systems issues, and people feel empowered, and then we don't break them like we used to in healthcare when I was in training. The third is, it sounds sort of obvious, self-evident, you have to have enough people. Staffing ratios do matter. And so having good ratios, and that includes, in ambulatory, having enough medical assistants for our docs, but, particularly if we focus on inpatient, having enough nurses and nurses assistants. And we have not always been there. But when Brockton closed, we hired 80 travelers. We recognized we were going to get incredibly busy. That was incredibly expensive. Our board never blinked, but we were not going to hurt patients and we were not going to crush our staff. And I think all of that's resulted in significant reduction in turnover. So we're moving in the right direction, we think. I think the next is leadership, having the right leaders and managers. I can take you on some floors where we brought in some new leaders, and it's just dramatic how much happier the staff are, and they love their leader. If I didn't believe in leadership, I wouldn't do this role. And so those are critical. The next is getting out there and rounding. And so I try to get to every floor every week. My admin gives me time to, I would say, takes off the ball and chain and allows me to go, we're from Quincy to Plymouth. Can I get down and visit those offices or urgent care sites on a regular basis, the medical center, the wound center? But I try to get to every floor, and you listen. And you really listen. And some days I'd get up there and, oh my God, you'd have the what beat out of you. But they were right. And the care wasn't what it should be. We had problems. Let's address them. Let's fix them. And now it's fun when people have 4 patients during the day and 5 at night. I ask them, what are you able to do now that you couldn't do? And the stories I hear are just breathtaking. We want those nurses and staff to go the extra mile. So those are critical. And the last I would say is investing in well-being. So our Chief Human Resources Officer, Darlene Souza, and our Chief of Women's Health, Dr. Kim Dever, made a real commitment to well-being. That predated me. And then when I got here, they hired Dr. Mike Navarez, who's a psychiatrist from MGH, and he's here nearly full-time. And some of that is individuals in healthcare, just like everybody, have behavioral health issues. They need counseling, they need therapy. They can even be acutely, suicidal. We need to intervene on that. That's one thing. But it's also, we have traumas here. We're a level 2 trauma center. So we have bad car accidents. We have horrible things happen to young people, to children outside of this institution. We're human beings. It impacts us. we have to be there for them. And so we often have debriefing sessions and further sessions to allow people to be able to talk as human beings, how painful that was. That child reminded me of my son. You know, we're human. We have to address those issues. And we've actually started Schwartz rounds again, which is incredible. So I know it's a long answer and I'm passionate about it,
No,
but I
it's a
think you
great
have
answer.
to focus. You know, it's our number one issue in healthcare.
It reminded me of the Schwartz piece. I'm glad you brought that up. It's a great answer, and it's filled with some nuggets. And so I'll just offer two short responses to it. One is I had another meeting with healthcare leaders last week that told me how you took them on rounds, and I you know, I went on rounds, and I just think what an awesome educational opportunity to open up the doors of the hospital for leaders to see what you're doing. And it does go away from that where we used to be, where everything was kind of closed down. We closed rank, people didn't talk about it. And the second is, you know, you're doing something right. I mean, I visit a lot of hospitals, as you know, all of them in Massachusetts, many around the country. The vulnerability, compassion, honesty that your staff showed, you know, that's leadership. They felt comfortable to be able to do that. And I appreciate that. And thank you for that. Let's move to the next kind of era of healthcare, which is innovation, right? If we don't move on and figure out how we're going to transform our delivery system, you know, as always, we've talked offline about what that means for our community providers and our hospitals in general. But you've been on the forefront of countless innovations, from you own your own ambulance, VNA, trailblazing mobile integrated health services. What are some unique things happening within your organization that make you excited about the future and changing the way we deliver care?
So a great question, Stephen. All of those that you mentioned predated me. So again, you come in, you inherit blessings in your role, and you move forward with those. So two things that are going on this spring. In fact, later this month, we're opening up 2 new ORs in our ambulatory surgery center that's in Hingham called Two Pond Park. So why that doesn't sound that innovative, but it is a recognition that more and more surgeries are moving to outpatient. When I was in practice at North Shore, we were doing Secure Horizons. We were focused on length of stay. I met with the orthopedist there, and they almost threw me out of the room because I said, I think we should be able to lower hip and knee length of stay to 3 days. And they almost shot me. And now we're doing it outpatient. It's incredible. So that allows us to have more capacity for inpatient surgery, and we're growing with neurosurgery, vascular, lots of other areas. So that's a right sizing. The other that I think is really exciting, and we're not the first to do it, but we're really excited about it, is hospital at home. So we plan to open that in June, Steve, where I think we're doing a little different. We're doing it homegrown. We're hiring within our nursing and our hospitalists to run this program. We already have the ambulance services. A lot of it's going to be with paramedics because we already are building on of our capabilities with MIH. There will be nursing engagement, but a lot of it will be paramedics. You know, people think you can get to 5-10% of admissions can be done at home. It's really exciting. And that gets me to my roots, which was the belief that while healthcare is wonderful, there's so much opportunity to change it, make it better care, make it more efficient.
I get real excited when I hear leaders, right? Because again, this goes to the now and then when you're talking about delivering care outside the walls of the hospital, right? So much before was we got to get people in the hospital. Now we have all of our leaders, some of the best minds in the Commonwealth, saying, get folks out of the hospital. I imagine quality improves, people are happier, it's better for your staff, it's better for your ED and for admissions. Is there an affordability option too? Do you think by doing that, we can be more efficient and save some money when we move people outside the walls?
Yes. I mean, it's a policy thing, Steve. Right now, CMS has the waiver, and they're actually paying full hospital rates. So we will get paid the same, whether that pneumonia patient or congestive heart failure patient is on Pratt 5 or is home in their home. I think over time, there's no question that CMS is going to lower those rates, and they should, because you're not having to invest in all the capital and all the resources that you have inpatient. So yes, I firmly believe it's going to lower cost. And we're working with primary care providers like Atrius, Optum, because they're very much into risk. So that becomes a real opportunity. So it is an efficiency, because I'm told every new hospital bed costs $2 million. So if we're going to run at 550, that means I have to build 200 more beds. I don't have that kind of money, and I think that's a waste of societal resources to spend that kind of money. So hospital at home becomes part of the solution.
Exciting. It's great. And it's right. People aren't running in to build new hospitals. So we've got to meet our patients where they are. And you talked about, you know, how you operate your hospital with flexibility, lack of rigidity. I mean, it's really exciting. So you're busy. You're working all the time. You talk to you in the morning on the way in, on the night on the way home, but you got 30 to 60 free minutes. Are you reading? Are you doing a podcast? Or you're watching Netflix? What would be your choice at a free hour?
Try to keep up with the news. I would say that the best book I read recently, it's right here, is called The Culture Code by Daniel Coyle. And I got to credit Dr. Jessica Dudley, our former CMO at the Brigham, for beating me over the head to finally read it. But it's a wonderful, and it's very sort of written around stories of companies, but it really focuses on three things, Steve. One is safety, second is vulnerability, and third is sense of purpose. So safety is that story about that nurse that said, I don't feel safe, and making sure she feels that she can say it, and me being vulnerable as a leader to say, I accept that you don't feel safe and we have to fix it. And then this whole sense of purpose, I think it's crucial. And so that was probably the best book I've read recently. But
Right.
yeah, I tend to fall asleep on the couch, which doesn't make my wife too happy when I come home. But
Yeah,
it's a
our
long
box is
day.
pretty full at the end of the day. Sometimes you just want to turn on Jack Reacher and not have to think about anything, right? Just watch an easy show. Do you have a must visit? You know, you're kind of not that new anymore, but to the Weymouth area, have you found a must visit spot for folks that are visiting the Weymouth area?
Ironically, I would say our hospital cafeteria has incredible food, and we have families coming in who eat here because it's a social thing. But in terms of really going to see places, I love being near the water. So I think there's World's End in Hingham, and Bear Cove are beautiful right on the water. There's also Webb Park in Weymouth, which is just beautiful with incredible view of Boston and the airport. So we love to take the dogs on those walks, and they're wonderful.
Well, if I take my family of six to your cafeteria, I'll just get a reservation, tell them you sent me, and we'll let you know how the food is. But I always enjoy having a coffee in your hospital because the people are so nice. And if you're having dinner with somebody dead or alive, who's your choice?
I'd have to say Abraham Lincoln, Steve. In fact, I'm just watching the Manhunt series on Apple right now, and I don't know how he did what he did as this nation split up, and how he stood up with such courage to end slavery in an incredibly divisive time. But
I have my statue right behind me. I just had to move it.
Oh, there you go.
See, there at the monument, one of my favorite spots to sit at the monument.
We think we're in tough times, right? I mean, give me a break. Compared to what he went through, we got it easy.
Last question. You're a lot of emerging professionals that are joining us this morning and then watch later on to hear some of the great insights from our leaders. Any piece of advice that's gotten you along your career journey that you give to others that are answering the vocational call to come into healthcare?
So I think when I took the job at the Brigham running the physicians organization, I met with Tom Glynn, who's an amazing man, as you know, and he was COO of then Partners MGB at the time. And he said, Alan, you're going to find problems at the Brigham that I don't even know about as COO. Will you do me a favor for the next 2 years and lay low, focus on fixing problems at home? I'm going to be looking for people to come with me to Beacon Hill or to Washington to talk to legislators. Please don't volunteer till you fix what's going on at home. And in a way, Steve, that's why, I appreciate the opportunity to join the board, but I live to that principle by saying, I think I've got at least 3 years worth of problems to focus on here. And they're not going away. We're getting better, but this is a long journey. So I thought that was really good advice. Like, really stay home and focus on what needs to be fixed at home first.
Well, it's funny you say that. I'll just share one of our conversations, which I don't think you'll mind. When I first asked you to join the board, you said, talk to me in a year. I got to focus on South Shore Health right now. And you did that. And then I called you back and you said, yep, I think I've got some bandwidth to want to do more now for the broader community. So exciting. And I'll say, I don't know, 10 years or so when I was looking at authoring chapter 224, my first call was to Tom Glynn. And we sat down at the Kennedy School and chatted for a few hours, and wealth of knowledge. So glad to be in a kindred there with you. Well, this has been a great conversation. I tell you, the time flies. I told you we get on and we just talk about some things, and our morning coffee would be over. So our time's coming to a close, and I want to thank you again for just taking the time to be with me today and to be open with us. It's been a pleasure to hear more about your journey, your vision for the future of care, and all the incredible work that's being done by you and your team at South Shore Health to support the communities that you serve. To our audience, if you enjoyed this morning's conversation, we host educational content every week of the year and have some exciting opportunities coming up, including our annual Emerging Leaders Summit and our brand new case management series. You can find more information at our website, mhalink.org. Thanks again for spending the morning with us, and look forward to seeing you back here for our next Executive Insights episode. And Dr. Smith, thank you very much. Pleasure to have you on this morning to share with our team.
Thank you, Steve. I enjoyed it.
Hope everyone has a great morning. Thanks.